We are here again. We are here again. Welcome to another episode of the pod. You guys, am I the only one who does not understand or know what is going on in our body? I feel like I really don't know anything going on in my body, and it's a bad thing. It's so bad living life like this. And you know what's even worse? What's worse is that I can't even talk about changes that I might notice or I can see or I have seen in the past that are happening in my reproductive areas because it's a taboo to talk about them. I mean, they're called intimate areas for a reason. But really, is this really a good way to live life? Like, why can't I talk about the pain I noticed in my breast? Or why can't I talk about the fact that my anus hurts? When I say my anus hurts, I'm talking about hemorrhoid. Hemorrhoid, guys. Nothing serious. Why is there so much shame surrounding these things, surrounding conversations on our body parts, on our intimate areas? Why are we really shy to talk about these things? Why? Because we feel like we might be judged, yeah. But on this episode, I think I'll be getting out of my shell a little bit and just try to talk about it. But I won't be doing it alone because, like I said earlier, I'm a culprit as well. And we have professionals to join us in today's conversation. One, we have Christiana. So Christiana is a nurse and a medical person. So she's going to be giving us insights from that angle. And we have my younger sister. Why did I have to do that? Maybe I could have just said her name. We have Matilda. She is an health educator. I feel like I'm not bringing her here to give us the health educator's perspective. I want her to talk to me like somebody that's a real proper Gen Z, because me, I call myself a senior school Gen Z. Real proper Gen Z, to give us the details of what it feels like to talk about your health in the sexual way. And just balance out the conversation, really, because I feel like my perspective, Christiana's perspective, and Matilda's perspective will make this conversation very wholesome. And we're focusing more on reproductive health in general and the shame surrounding it, because this is the month of October. It's the Breast Cancer Awareness Month, and let's talk about these things. But anyway, remember to like, share, subscribe as we move into the conversation of today. I hope you enjoyed the podcast and you enjoyed this episode. Hey fam, you're listening to Becoming You, the podcast for adults figuring it out. Now let's get into it. I'm an adult. What am I supposed to do? So how are you guys before we get into today's conversation? How are you really? Shall I can go first?
I'm fine. Coping. Adulthood is a lot, but we are pushing.
It is actually because did anything happen in the past week that just made you so excited? Or
I had an assessment at work, and I wasn't to write it, but my colleagues were writing it. I've written mine before, but everyone ended up passing, which made me so happy. Yeah. So
That's nice. That's good to hear. Dara, how about you? How was last week? Did anything exciting happen?
Oh, I'm good. Last week went well. I made this amazing recipe. I saw this amazing recipe online and I tried it out. It's called potato chicken drumstick, and I
Nice.
must say it was really, really delicious. And also, I got to see my friend last week, and I was really excited to see her. So yeah, my week
And
went
that's
well.
like exciting stuff. Exciting stuff. Send me the recipe after the yeah, send me the recipe after this recording. Let me try it out as well. Okay, so for me, last
All
week was
right.
just, it was stressful, very stressful at work. And I think the exciting thing that happened was, let me see, Friday, I dropped the content. And for the very first time, I did this paid ad on Instagram. And to my surprise, I got so many views and people following my accounts from the paid ad. And it just made me feel
wow.
doing, yeah, it made me feel like I'm actually doing something right. And maybe at the right time, people will find me. But you know what happened as well? When I saw people viewing the video, I got scared. I was like, why are they watching me?
Now you have to decide what you want. You have to decide on that.
And I'm like, I feel like I need to still work on my mind. You know, when you want to be seen, but you're still scared that if people see you, they will have
Yeah.
experience to meet up to their expectations. I want to be a girl. Sorry, guys. Sorry to disrupt your listening experience right now. I just want to tell you that we ran into a very serious technical issue while recording yesterday, and one of our speakers' audio and session of the pod went missing. However, we had to re-record, and I just had to find ways to insert her takes into the pod. So in case you notice some kind of things that are not exactly correlating, just know it's because of this. But I promise you, I've tried my best to make it like turn out very good for you guys, and I'm sure you're going to enjoy this episode. Thank you. Please listen to the end. Okay, so today we're here to talk about sexual and reproductive health. So, like, October is the Breast Cancer Awareness Month, and we'll talk a bit about that as well because we're all girls, and we can get to talk about our breasts without making that shame. So, I feel like conversations on sex education is something that our African parents do not embrace. This African
Yeah.
society, Nigerian society actually does not embrace it as well. But like, I don't know why is that. My sister is here. She volunteered with like a group where they were talking about sexual health and stuff, and our parents had issues with this. I'll let her speak for
They
herself.
will.
So, like, yeah, they had issues with it. Like, so, like, why do we have this stigma surrounding sexual health? Like, that you can go first, share your experience volunteering and why you think people think that's such a thing to talk about.
Oh, okay. So I feel or I believe it begins from the culture, our society, our religion. They all see sexual health education as a topic that is bad, as something that is
Yeah,
immoral, and it's way beyond sex.
Yeah.
It's way beyond that. It's way beyond that part of
yeah,
sex education. It entails boundaries. It entails knowing your or understanding your body. It entails consent, because most people, when
yeah,
they hear sex education, all
Yeah.
they believe or all they feel is just, oh, is the sex part they are teaching them, or unwanted pregnancy or infections. But it goes way beyond that. You're supposed to tell your child that, oh, this part of your body shouldn't be touched by
Yeah.
some, either a male or a female, because some females touch other females
yeah,
in a way that they don't feel comfortable with it. So it's not only the guys or it's not only the males that can violate your boundaries. So I feel it goes beyond that. And our parents or any
Yeah.
our older parents listening to this, they should learn to be flexible. It's better you even teach your children sex education from your home before another person or an outsider teaches them or practice it on them and you would not like it. So it's better you teach them from the
Yeah.
comfort
It
of
is.
your home and let them understand it than allowing an outsider teach them. There was a time, sorry, my organization used to do this yearly stuff that they provide health screening, free medical checkups, and they provide um proper education, proper knowledge. They call
yeah,
professionals to
Yeah.
enlighten youth generally. So last year,
yeah,
yeah, last year they brought the what they did last year was they provided free vaccines on HPV and HBV, hepatitis and human papilloma virus
yeah,
vaccines. So
Yeah.
they educated us that, oh, it's not only by sexual intercourse that you can contact these things, or that even them as nurses, as medical practitioners, that they are the front line of be getting or getting infected by this virus. It could
Yeah.
be physical contact, sweat, or
yeah,
body fluids coming in contact with each other, even inside bus. You could go to the hospital, you could touch something that an infected person has touched and boom, you've gotten it. Or inside public bus
Yeah.
or
yeah,
touching the stairs. So they advised us to collect it to get vaccinated. And they also told us that if like when you're a carrier of the virus, you can't even get the vaccine. So they tested us, they made sure, oh,
Yeah.
this
It is.
person is not a carrier of the virus before they gave us the vaccine. So I had to tell my dad because I was supposed to come. I was like, dad, though, I'll be coming
Yeah.
home late.
It
So
is.
because of my vaccine, I have to complete the vaccine. If not, I'll start again. And I didn't want that. So I told him. The next thing was like, hey, did you have the virus? Where did you get it from? Ah, Rich, what are you doing in school? Can you I
I,
was I was so confused. In my head, I'm like,
I remember
Daddy,
on the group
calm
chat
down. That was
that
not
day.
what they told us. They
Yeah.
educated
Yeah, trying
us
to
properly
continue.
on this thing.
Yeah,
That it's not only by sexual intercourse that you can get this HPV or human, I mean, or hepatitis. That You could get it from anywhere. So like, daddy, calm
Yeah.
down. It's not that deep. But my daddy took it personal. I was really like, I was worried that I was so scared that what was going on now. What did we
Yeah, just to add to what Sharon said, I remember when she said she was getting an hepatitis vaccine. My daddy called me. The group chat was on fire. It was like, "Hey, don't take this home. She vaccine." Like what she doing was you just felt like she was being wayward and maybe she had
Yeah.
tested for it and that's why she was getting vaccinated. And like that brings me to you, Christiana. I mean, you work in the health space, you see people come to the hospital and maybe they are so scared to even talk about what's wrong with them and they are just going to be whispering like I feel like I'm feeling discharged something you can't talk about. So why do you feel like we're so scared? Do you think health practitioners to make it easy for people to open up?
I think Matilda said, there is this stigma. Well, I say stigma of fear of talking about sexual education. It's both cultural and religion because culture makes you feel like it's immoral. At the same
Yeah.
time, religion makes you feel like it's a sin. But the only sad part is we don't realize that it is not just about sex. Sex
Mm.
education is not just about sex. It's about a lot of things. Knowing yourself, know your body, know boundaries. It's very good when you let your child know that you are this is your vagina, this is your penis. People should not get to these places. Those are sexual education as well. But our parents are and you will be surprised that it's not just our parents. Yeah, we feel the same thing in the hospital. People will come up to you and be like, I'm bleeding down there. Excuse me, down there where? Your leg? So sometimes you just have to like make the because you do understand how it feels. So make the environment relaxed. Like down there, is it like where is it coming from? Don't be scared of saying it. The same way you can tell me your hand. It's okay if you tell me your vagina, as well as your hand is a part of your body. Your
Yeah.
vagina is also a part of your body. So and all of that. So it's really dicey, and I think it's just time. It's high time we understand that we have to know that it is not a sin, and it is sexual education is not just about sex. It's about your body boundaries, knowing yourself, knowing when things go wrong, knowing when you should talk about it. We've seen situations of children having their periods and they are not talking about it. Girls have started their period, they are not telling their parents because they feel how they have a culture and tell her that I'm bleeding. Blah, blah, blah. So it's not supposed to be a shame.
Yeah.
um because I think I've talked about it one time. I was in the midst of people, maybe I think it was in church, a church gathering. Then I went, oh, I'm having cramps, I'm having menstrual cramps, and someone went, you shouldn't say that outside. I'm like, why shouldn't I say that outside? If I can go out and tell people that I want to go to the toilet, I want to do number two, I want to wee, why should I be ashamed of saying I'm having menstrual cramps? So it's just like that. You'll be surprised. So but really,
Actually, like I've
yeah.
had people say, like I think there was a day I was talking about periods too and cramps, and I was like, oh, I just had my periods today, and I was like, nobody wants to hear that. I'm like, okay, like
I
why?
don't. Why don't you want to hear it? It's. I
Why?
mean,
I
but
don't know if
yeah,
you're on Twitter as well. Last week, I think last weekend, one guy posted, we should bring shame back into the society. Girls should
yeah,
stop thinking
yeah,
about their period. And I was like, I grew up all my life as a teenager. I was so scared of saying the word menstruation. So
yeah.
scared of saying I want to buy pads. So scared of saying buying pads was felt like a shameful thing to do. I'm like, why? Why do we make things very like difficult for girls? And I'm part of those people that find it so hard to say vagina. Oh, that's a bum bum. I'll be like my bum bum. Everywhere bum bum. And I think it's a bad thing. And Christiana, do you feel like medical practitioners actually make it easy or easier for people to open up when it comes to sexual and reproductive health? Because going to the hospital as well, maybe you're complaining of a kind of pain, then the doctor will go, when last did you have sex? In front of your mother. And like they just make the whole thing feel a bit uncomfortable.
Yeah, so medical practitioners really, I think it depends on who you are meeting, but the way we are trained in school, you have to understand that there's confidentiality.
Mm-hmm.
Patients must be able to tell you what is wrong with them. If you are speaking to a child, most times you have to be with the parent. They have to be with the parent. But if the child is not comfortable with speaking to the parent or speaking in the presence of the parent, you might as well just tell a chaperone to come inside. So the right thing to do is you have to get the truth out of everybody, but at the same time, don't make them feel in a difficult, because they're going to lie to you. They will lie to you. I think I was reading about just I was reading about the youngest pregnancy sometimes last week because I spoke about it with someone, and just in the middle of all of that, I saw a child that was pregnant and the parent didn't know all of that. It was not even Nigeria, so it's just very important that we make the environment safe for the patient to talk, because they won't talk. So if it is not right, I feel if I'm going to speak to a child with their parents, I wouldn't just go, are you sexually active? Because they will never be. Even at this point, I'm married, and I think if I'm asked, am I sexually active? I will, in the presence of my dad, I will still want to say no. Because I don't want to. It's so annoying. I think we had this conversation sometimes ago. I think myself and my husband, we just talking, and I said, do you think people are going to like think about things like that? Maybe you have a child and people know that you're already doing something. Jesus. And I was like, what? So imagine myself. What I'm just trying to say is that at this age, I still have that cloud that I don't want them to know. So now imagine you asking a child, let's say, even if the child is 18 or 19, in the presence of your dad, they will say no. The answer will always be no.
Of course, it's no.
So it's always been no. So yeah, it's just very important. That's sometimes when there's no like one rigid way to ask people. There's no, this is the rule you should follow.
Yeah.
It's just as a medical practitioner, you will observe the situations, you assess everything, and see what should I do in this situation. So wisdom is profitable to direct it sometimes. Yeah.
I
So
like that. It's
that's
not
just
just profitable to direct. Like, I feel
yeah.
people should just always put context into like consideration when addressing people. And Christiana, you mentioned
Yes.
like briefly that sexual health is not just about sex.
Yeah.
And can you just like, I feel like we just went straight into the conversation without really defining it. In your own way, how would you define sexual and reproductive like health?
Okay, so in my own way, let me not go into I don't want to just like the just definition that I'm going to give it by myself
Uh-huh.
is it's it's like a wholeness, like a whole oh, I'm trying to look for the right English now, but it's like, oh, it's all round. It's not just about sex, it's about your reproductive organs, looking into it, when things go wrong, when this is happening, is it the right thing, is it the wrong thing, knowing the physiology, knowing the pathology, the right one and the wrong one, knowing the boundaries, knowing when to set boundaries, know what part of your body people should not just abuse. People will say private parts. I remember there's one of my lecturers in uni that says, oh, private parts, so your hand is your public parts. No, it's not your public, so there's nothing like private parts, yeah, but you should know when to stop people from going to some parts of your body, especially as a child, because there's been cases of sex. So that is also another part of sex. So sexual education is just like making children, not even children, everyone know everything about their sexual health and reproductive health. Which for a lady does not just mean sex. I mean, your breast, when to know if you're having some lumps in your breast, if anything is going wrong, knowing your periods, know everything that surrounds it. People go around saying, why should the child learn about ovulation? They should learn about their ovulation, because you might not even be ovulating and you don't know it. And if it is caught early, it is easier to treat. So it is all about everything that comprises of your reproductive system that you can think about. So it's not just about sex. It's just so sad that maybe because it's sexual education, we already think it is sex.
What did your lecturer say? That we should not consider
Yeah.
this as like private parts. Like,
Yeah, it's just So because I think why she said it that day was someone was trying to a colleague of mine was trying to define something or say something, and she went private parts. So the problem is still part of what we're trying to say. Like you saying sexuality is, I think where the word private part came from is just people trying to avoid saying vagina, trying to avoid to say penis. So when you say private part, what's private part? Your hand is your hand public part. Am I using your hand? So that was what she was trying to just abolish, like not being able to say vagina, not being able to say penis. She went, it's okay for you to say your eyes, but why how is it wrong to say your vagina? It's still a part of your body. So that was why she said it. Yeah. She said it in class that day. No.
Actually, I'm even learning from this
Sorry.
podcast because it's so funny how the shame is actually ingrained in everything we do, in our the way we
Yeah.
talk, the way we address situations.
Yes.
I would have
Yes.
felt like I'm still a very progressive person, but saying private parts and intimate areas. Like
Yeah.
feel comfortable calling these things what they are really. And yeah, that's a nice one. That's a nice one. And still, like,
Yeah.
is it normal? Is it okay for a lady as grown as I am not to track her period?
It's not.
But this thing is in call Alejo. You know, Alejo will just call. So I'm just letting it do what.
You have to know when your allergy is coming. Sometimes it's not just about the period.
Yeah.
Sometimes it's about so when you there are different conditions now that has to do with periods, that has to do with our menstrual cycle. There's PCOS. There are people going around with PCOS and you don't even realize that you have it because probably because you don't even track your period, it just comes. But when you track your period and you see that okay, this is already 40 days, I've not seen my period. This is 45 days, I've not seen my period. Because you are tracking it, you're able to see that there's something
Something
wrong.
is wrong.
For me, if you wake me up by the middle of the night, what's your LMP? I can say it.
Are you
So it's
serious?
and it has always yes, I can always say it. I know when I started my last period.
Is this
I
because
think the
you're a DOS?
um before I think it started before I even started nursing school. That's the funniest part. So you know when we're in secondary school, we had like nurses coming in with always I don't know if
Mm-hmm.
you had the experience like always coming to these always people coming to your school, they will give you like free pads, all of that.
Yeah.
So I've not started my period when they first came to our school,
Mm-hmm.
but I was so enthusiastic about starting my period because everybody has started their period. And at the point, I think I even started lying that I've started because it's just like it's
Actually,
just like it's just like a group of friends. Everybody have started. It's only you that have not started. Ah, no, I mean to have started with two people. So it was just like, and then I think one of them gave us like a calendar that you
mm-hmm.
can use to track it, and that was just the beginning for me. I started tracking it from then, and I got so used to it that because I have every period sometimes, and I don't want to be disgraced. So
Yeah.
I got so used to that. I want to know when next year coming so that you don't just come and meet me in the middle of the assembly. So from there, it just became like an habit. Sometimes when I'm even like with my nurse colleagues, and I'm like, and they say your LFP, and I can say I don't even know what my LMP is. I know what mine is, and even if I forget by any chance, I have like apps. I have this is not a public, this is not an advertisement, but I have apps on the phone
Yeah.
that that used to track it. So it's just best, and the reason is just because it helps you. There's
Mm-hmm.
something in medicine, in medical line or whatever, that we call early detection. When you
Yeah.
detect something very early, when you catch it, like catch them young, when you catch it very early,
Mm-hmm.
it is easier to maybe treat,
Oh,
to do anything to. Yeah, so that's just yeah,
yeah, that's totally
that's it.
right. If I don't take anything out of this episode, I need to take out the fact that I need to start, monitoring my period. And yes, I need to know what's
Yes,
going on. Because
yes.
I've had so many embarrassing moments of just being in the hospital for consultation, and the doctor will ask, "When was the last time you saw your period?" And I'm like,
I don't know.
the doctors are usually embarrassed on my behalf. So,
Yeah, I'm gonna judge you. I need to know your. Do
yeah,
you?
one of them, Christiana, you are one of them. That's a good one.
I will judge you, my mother. I will say okay, no problem, but I will judge you, my mother. I want to know your period. Do you even know your name?
Actually, it's actually very
Yeah.
important. I'll change. I'll download the app after this because I have one app that I use like my friends use as well. So I'll just download it and try to track it. So, like, there are so
Yeah.
many, because we don't talk about sex or reproductive health in our society, people tend to learn from friends, learn from colleagues online, and we just sneak around trying to find information from where we can find information. And I feel like because of these things, we have myths about sexual education flying around. So, I want you to tell me just one myth on sex that you know, or sexual health and reproductive health that you feel like it's so dangerous, but it is still existing and it has existed for the longest period of time. Dara, you can go first there, Christiana.
Okay, I've heard a myth that if a lady uses birth control, she'll become infertile for the rest of her life. She'll deal with infertility for the rest of her life. Two, some people will tell you that they can tell when someone has STIs, and I'm like, it does not show on your face. HIV does not show on the face. You see someone living with HIV and the person will look more healthier than someone who doesn't even have who doesn't have HIV. Because now there's even treatment, there's the treatment that they use to manage HIV. There's no cure yet,
I
but
mean, there's a song they taught us in secondary school. It is real. HIV, the show for face. Like, you cannot see it. Like,
You won't.
you won't. Yeah. So, Christian, how about you? Are there myths like you've heard and you're just like,
Um, I think I've got like 100 in my head. I just go, eh? The first one, I think the strangest one I've had was if you're having sex for the first time. If it is your first time having sex, you cannot get pregnant. And I'm like, okay, just do it. Just try it when you are ovulating. And we're going to see. So yeah, that was the first one I had. That was not the first one I had, but that was the most shocking one. That if it is your first sex, you won't get pregnant because it's your first. That was strange. And the other one I had was, I think that was actually when I was in secondary school. That if you are pregnant and it's early pregnancy and you are running up and down, jumping, you can lose the pregnancy. But when I think I maybe I also believed it then because it somehow made sense. I mean, it's just early baby,
actually,
so
it
it
makes
can just
sense.
come out. But
Like,
the pregnancy there's one that they used to say in Yoruba. They would say, I don't speak Yoruba, but then I will say it in English that the pregnancy that will shame you, it will not abort. Like,
actually,
but apart from that, it was just so funny. I Unless there are maybe underlying conditions or anything, I don't think jumping up and down can make anybody lose a
make the baby
baby.
shake.
There are people that yeah, there are people that go to gym and they are pregnant and they don't even realize until later. So it was strange. And I think another one I had was that taking antibiotics when you are pregnant, like it can abort the child. Maybe maybe there might even be like complications, but it's not an abortion
Not
pill.
abortion pill. Yeah.
Yeah.
I think I have just one myth to talk about now, and it is very controversial. Very. And I want you guys to correct me if I'm wrong. This one is all virgins bleed. It's
All virgins bleed.
bleed.
It's a lie.
Yes.
It's a big it's
Yes,
a
it
big
looks
fat
like
lie.
growing up and everything. They make us feel like when you have sex for the first time, you see the pool of blood. You find yourself in a pool of blood. And it's like, yes,
Oh.
it just happened. And like having conversations with friends, then you realize, okay, so we all don't bleed. Like the whole bleeding thing
No.
is actually a lie. Am I right? So
Yeah, you're very right.
what causes the bleeding?
So, so I think bleeding sometimes. So what makes us say we are a virgin or we are not a virgin or whatever is your hymen. Your hymen
Yes.
is in place. But the weirdest part of all of this is that the hymen does not even need a penis to break. Very serious exercises, rigorous exercises like cycling could have broken the hymen.
Oh,
That is one. And the hymen might even be in place. It's not like what will I say now? It's not like a big or a large or a mix. It's just like a tissue. So it's not like something that you need force. Then when you put it
yes.
inside, the blood will come out. No, it's not like that. So sometimes when another thing that can make you bleed is when maybe the partner is not very patient,
Yeah.
when maybe like force was used. But if you get lucky to get in a kind partner that could go with the flow, there's very high chances because there's been no force used. There's very high chances that you won't bleed. So saying that all virgins bleed, it's a lie because not all virgins bleed.
Actually,
Matilda,
no, not all virgins bleed. I attended a program
yeah,
late this year, but not late, mid this year. Sorry, mid this year. So someone asked mid this year. So it's a lady
yeah,
or a guy asked. I don't know if it was a lady or a guy that asked that. Do virgins bleed? Someone asked that question. So the facilitator, she's a medical student. She was like, not all virgins bleed. And they're like, why, how come, what
yeah,
happened? So she said the hymen is a very light, tiny tissue that if it's forcefully penetrated, I mean, if forcefully penetrated, it could cause
yeah,
this. hymen to tear and result into bleeding. And some people might still have their hymen intact and they are no longer virgins. Okay. She also mentioned that if you're someone that is physically active, if you're a
Yeah.
sportswoman, if you do vigorous sports, that you have high possibility of tearing your hymen because of the stress you
Yeah.
put your body through, or jumping jacks, the splitting, the running, the high jump, all those stressful, vigorous exercise that you engage in. It
Yeah.
could result into the tearing of the hymen, and that doesn't mean you are no
Yeah.
longer a
Yeah.
virgin.
I check it out because I'm always on Twitter sometimes. Like, and when it comes to matters like that affect ladies and girls and all, I'm always quick to talk. So I tweeted about it, but my own hypothesis at the time was that like all virgins, like in the olden days, they believed that all girls would be like when they're having sex for the first time because the sex were done at that time very forcefully, and most
Yeah.
of the girls
Forcefully.
and women were younger women, and the men older men, like 10 years
Yeah.
older, 15 years, and it's just running into it. And that's why probably they were bleeding that time. And I was just like,
Yeah.
imagine how many ladies were ashamed for not bleeding. And they were actually virgins at the time.
Yeah.
Like, ignorance is really a disease. It's a disease. But is it something you
It,
feel like you hope they taught you earlier about sex and health education, or about your body, your reproductive health education? Yeah, Matilda.
yeah.
Okay, I wish they told me that sex education is not only about in unwanted pregnancy, unwanted pregnancy and infections, because you hear that if you engage in sexual sex or sexual
Yeah.
whatever, that anything sexual, that you become
Yeah.
pregnant or you have infections, but it goes beyond that. I said earlier that it incorporates consent, or it includes consent, boundaries, and understanding your
Yeah.
How
body.
about you?
Yeah, I think it's just like the same like she said. Like it's just so sad that people when we were in school, no one really talked about even periods, if not for always. No one really like maybe at home, yeah, definitely my grandmom, she used to like talk about your periods, what to expect. But then it was not something that anybody wants to hear. It wasn't something that anybody wants to talk to you about. Everyone was just about sex, about the baby, you will die, if you
Yeah.
die, that's the end of life. So it was just like a whole lot. I wish someone had walked up to me, tell or even when we were young. I said something one day to a friend that in 100, if you pick 100 ladies together and in a room and you ask them about being sexually abused, 98.5 had one or maybe one or two things that they weren't comfortable with, but they never said it to anyone.
Yeah.
But we've had situations of people being raped and they don't talk about it. Why? Because they think
Exactly.
it's shameful.
Mm-hmm.
They think it's shameful. So all of these things, I really wish someone had said it maybe when we were younger, let people know. Because at the end of the day, people, youth are going online, like she said, rightly said, you are learning about everything that surrounds our sexual health. Many people are learning about it the wrong way from friends, listening to the wrong information, and it's just
Yeah.
so sad. It's very normal for us to be inquisitive. It's very normal for us to be curious, for us to want to know what it is, and because there's not a lot put in place, I think it's better now, a little bit better
Social
in
media.
schools, social media, yeah, but it's always just better when we let children know from home what to expect, what when to say no, when to go no, don't do that to me. I'm going to tell my mommy, let them know. So yeah, so it's just like she said. I wish we can understand
I
that it's not just
mentioned earlier about
yeah, yeah,
boundaries and consent and understanding your body. So I have a story to tell. There was this day, I just finished secondary
yeah,
school. I went out with my mom. I don't know if my mom can remember the story, but I went out with my mom and we were sitting in the bus. My mom was beside the window. I was sitting next to her. Then there was this man, an elderly man, no, but someone in his mid 30s or early 40s. So the man sat beside me and we were waiting for people to enter the bus. Then a school student entered. She was in her uniform. She sat beside the man. And I noticed the man touching me. And I was so confused. I was like, why is he touching me? Why, excuse me, why are you touching me? But I didn't confront him. I told my mom that, oh, mommy, oh, this man is touching me. He's trying to like touch my body in a way that is in a very, very funny way. So my mommy too did not argue with me. She told me
Yeah.
to, we exchanged seats. I sat beside the window. She sat beside me, then the man, then the schoolgirl. And I know the man cannot shout. He can't touch my mom. He can't touch a married woman. He cannot stretch his hand across to touch me. So as we were still waiting for the bus to get filled, I don't even know what my eyes was looking for. I just saw the man I saw the man touching the girl, but she couldn't like she didn't voice out. I didn't know if she was comfortable with it. I'm 100% sure that she wasn't comfortable with it. But she didn't have someone to like talk to, or she was probably scared that if she should talk, the man would deny it.
And I'm going
Yeah.
to put you on the
So
spot now. You saw him
he
touching
was
that girl. What
ugly
did you do
because
about
like
it?
I was naive, I was
You,
young, and
you
She was
I
just
didn't
a
want to look
small
stupid
girl.
because my own self, the man was already looking like, oh, what's going on? So if I had spoken
get
up, if the girl could have maybe because of fear or shock, she could have denied it, or
Yeah.
she could have said, oh, nothing happened. Not because she was comfortable with it, but because she didn't want to look like a slothful person, or she didn't want people to pity her or look at her in a shameful or disgustful way. So I felt that if I had spoken up at that time, I might have
well,
looked
there's
stupid
that
and nobody
sharp,
might have
but
Very
believed me.
valid.
sometimes,
Yeah.
like, let me just stop from the girl's POV. I feel like most times you're afraid to speak up because the man will definitely denies. And it's going to be like, when did he do it? Is it not the boss that is just moving and stuff like that? And you start feeling stupid because society has made talking about these things a shameful thing for a woman. I mean, you're having sex with a guy, but the guy is not being shamed for doing it. You as a woman, you tend to carry it
Do
for
you
your head.
get?
The guy is counting your body counts. Meanwhile, he's just like a public person accessible to everybody. And I was telling my friend one day, I said, men are more cheap, like men are cheaper than we talk about it or than they appear to be. Like they make it look like girls are the cheap ones. But these people are the ones that will do anything. Sometimes humiliate themselves to like have sexual intercourse with ladies. So, but like the society just kind of makes it normal for men to do those things. Makes it normal for a man to body shame you on the road. Makes it normal for a conductor to smack your bum bum. Makes it normal, and you cannot say anything. One, because you'll be shamed for talking out loud, and two, the man can even beat you on top. The girl can say something, the man would insult her and even hit her that, why would you say that to an elderly person? Why would you put
Yeah.
that? That's the next thing you will hear. Like, what do you have? Why would I touch you? I have your type, but
Yeah.
it's just really sad, but that's the sad reality. Very sad. But next time, speak up. Speak up for your sister. Your sister's keeper.
Yeah. To be very honest, it was even very good that you could talk to mom about it, because there's some people that you will be so maybe in shock, maybe so ashamed that you won't even be able to open your mouth. You're just going to be there down, you frozen. So it's just even very, very good that you could like talk to mom about it. So you
Yeah.
tried.
Do you know the funny thing is that when you're being sexually assaulted, I feel like we're digressing, but it's a good digression. When you're being sexually
Yeah.
assaulted at times, you don't know what is happening to you until it happens. Like, there was a time
Yeah.
that I was going to the gym. I think that was in 2023. I was going frequently, and the gym happened to be like a deserted one. Sometimes I'm the only one there, sometimes I just two. And this gym guy, the gym instructor, was being so kind and so nice. And after like my gym sessions, he won't have me massage. Like he would just say like I should stretch on this gym mat, stretch my hands, stretch my leg, and that kind of thing. And the last day I went to the gym, he said I should lie down. It was just me and him. Then he started like pressing my belly. And like at that point I was like, what is going on? Then somebody walks in and immediately stood up. That was when he clocked that something is not right. And I called my friend that frequents the gym. I was like, do you get massage at your gym? And she was like, no. So that was when it dawned on me that okay, something was actually like something is wrong. And this happened after I finished the university. I was already a graduate, already grown up. So like we are not actually like it can happen to any of us at any time actually.
At any time. Yeah.
Yes, and you might not clock it early. I started going to this gym, and this guy messaged me, "Oh, sister, why did you not come?" I said, I was happy I was able to confront him in the chat. So I was like, "I'm not coming because you touched me." And I was like, "Oh no, that's why his gym is special." He gives everybody a breakout massage. I should come back, please. I should come. I should
Come back, phobia.
seriously. So yeah, I get you there. Sometimes you don't really understand what's happening because you can't even imagine that somebody would stoop so low to do certain things.
Yeah.
It's always very shocking. That's true. And going back to like the conversation of the day, which is on like the month is like a breast cancer awareness month. And first, when last did you guys check your breast for lumps? I have not done that in ages. I don't think have I done it before? I mean, I don't even know how to identify if we have lumps there. But let's hear from Christiana first. Like, what is breast cancer? And how can you identify lumps in your breast? Is it right for us to check it? Checking it is not touching yourself, right?
It's not touching at all. It's not touching yourself. So breast cancer is just like I think the easiest way to put it in a layman language is there are cells in our body. Our entire body are made up of cells. So when some cells, when they grow wrongly, when they grow the wrong way, they can form lumps. So it's just like it is supposed to grow, yeah, but it is not growing rightly. So it has formed lumps. Now the problem is not all lumps are cancerous. There are people that have had lumps removed from their breast and it's not cancerous, but it's not just always very good when you catch it early, like I said, and checking our breasts is not, it's not sexual, it's nothing sexual. I think I even do it like maybe unconsciously now. And there's something called BSC. It's just like the easiest way to, you can go online. There are things about how to do it, how you can do it in a mirror,
Oh,
how you can
okay.
do it in the shower. So when
Yes,
you
right.
BSC, it is breast, yeah, breast self examination, breast
Okay.
self examination.
Okay.
So when you go, it tells you what time to do it because sometimes it's not always very good to do it at some time in the months. Maybe like immediately after your period, all of that. There are things to look out for when to do it. So when you catch on, it's not just an to tell us when you like browse it out, breast self examination. I'm going to like give us an overview of what to look out for. It's not just about lumps. Um because I've noticed that people just look for lumps. Sometimes
Yeah.
it's as easy as looking at your breast, looking at the two. Definitely, we don't have the same size of breast. The two breasts are not the same. But when it is too obvious in one breast that it's bigger than the other one, you might not even see lumps. You might, but it is not just about lumps. It's as little as if you start having dimping, like the skin of oranges. If you start having that on your nipple, if you start having discharge, you're not breastfeeding and there's discharge coming out of your nipple. If you start feeling pain, the, there are times you have tender breasts during a cycle, maybe when you are close to your period or when you are close to ovulation. But when you start having pain that is continuous, you might have to get it checked. And there's been situations where people feel pain. They even like try to check for lumps. They can't find any lumps. And when they get to the hospital, there are lumps there. Not even one, not even two. So when you start feeling something is wrong, when something doesn't feel right with your breast, even when you cannot see lumps, when there are these other signs are there, the dimping of the nipple, the areola, when you start looking like, you know how the skin of orange is,
Yes.
that dot. When you start having that, when you start having discharge from your nipple, when you start having coloration, things that don't just look normal and you feel like there's no lumps, please just come out. Like, get it checked. It might not even be cancer, it might not even be, and people are scared. I've seen situations where about sad stories, to be very honest, because there's nothing as heartbreaking as when you see that this could have been avoided. I've had a situation where someone told me we were in school and she said a friend, I think the mom's friend had like lumps in her breast. And the first thing I said was, let her get it checked. They said, no, she does not want to get it checked because she's scared there might be cancer. And I don't know if it is just a Nigerian thing, but there's this thing that we feel that ignorance is bliss. If I don't know it, if I don't know I have it,
I am guilty.
if I don't know I have it, it can't kill me. But it's just so it's really sad because when it is caught early, it's easier. But for this woman, it took a very long time, and at the end of the day, the lumps were cancerous, and it was really sad. So it's just always for me. I think even maybe because I'm a nurse or because I'm medically trained, it makes it more difficult for me because for me now if any of my family member calls me and say I have headache, I'm already thinking about 100 reasons why you might have the headache. So I won't even tell you to take paracetamol sometimes. If you say you have headache today, I might just take paracetamol. But if you come tomorrow again that you have the headache, I might just go to the hospital, go and get it checked. Because I'm that scared, when you know what is at stake. So what I would say is, if you can go online, there are pictures, very easy pictures to do, how to lift the hand, how to check for the lumps in the shower, how to do it on the bed, or how you can get someone to do it for you, somebody that you trust. So I'll say it's just yeah, it's just always very better when we get these things, when we catch it. And don't be scared, don't be bothered. It might not even be that difficult, it might not be that deep. About times I felt like I had lumps and it was not even lump, it was just the normal breath. For me, I'll just run out and say, help me, please. I don't know what's going on in my breath. So it's just always the best. There are people that have had lumps removed from their breast, and at the end of the day, it was not even cancerous, and that was all. It was just cells growing. So, yeah, it's just the best. Don't be scared, though. Anybody that is listening to this, please don't be scared. Me, I'm big. Yeah, I'm big on early detection because everywhere in the world, when it is detected early, it can be solved. In fact, recently, I had someone that called me that she had breast lumps. And to be very honest, I just got to know recently that there are now tablets that they even take, or maybe some things that it's not even just surgery now. So I was surprised because I already prepared the mom's mind that they might have to like do lumpectomy, but it's not a big deal. It's, it takes you when we're in school. It was a day case. Yeah. You just go that day, you come back to your house. It's not like they will admit you. So I already explained everything. And she called me and said that some tablets can work. Oh, I'm still reading about that one. I'm not totally, I don't know so much about it yet, but so it's just that easy. Why? It's just because it was caught on very early. So please, it's very important. Breast self examination should be something that we do as ladies, as easy as maybe shaving or doing anything, or as revamping our wigs. So it's something that we should learn how to do by ourselves. So yeah, it
It
thank you.
just feels like you schooled me, you counseled me, and you like scolded me at the same time. Because I don't know, like I feel my heart is heavy. I am one of the ignorance is bliss group. Like I'm one of those that believe that what you don't know will not kill you.
Okay.
Yes,
Yeah.
what you don't know. And like there's this terrible pain I've been feeling in my back for a very long time. But I'm just living with it because I'm so scared to realize that maybe it's something I have to treat, or I have to go to the hospital back and forth for. And my friend will always tell me that, when it's time for this thing to literally sit you down, it's real. And that hospital you don't want to go, you
Yeah.
literally have to go. Right?
Please
Yeah.
get it checked. Get it
I'm always
checked.
fighting with Olu as well. When he's like, I'm telling him that I have headache, he's like, what kind of headache? Which side of the head?
Ah.
I'm like, just tell me to use paracetamol. Why are you asking me questions?
No. No, because you are
Like,
scared.
there's always an underlying cause. There's always this one. I don't like you guys are stressing me out. Yeah.
No. It's just knowledge. It's just because
Yes.
what might be wrong, what might be going wrong, and you are just thinking about 100 symptoms at the
Yeah.
same time. You're trying to link it. I have that issue now. When there's anything wrong with anybody or myself, I'm always like going. I'm telling you, I think I have this thing. I think I have this thing. It looks like the symptoms of this. It goes. You're just sitting in this house, diagnosing yourself. Don't bother going to the hospital. Just sit down here and write all your conditions on the paper. So it's just like that, really.
Yeah.
But when it's caught on early, it's simpler. Yeah, just let's put it that way. It's simpler.
Yeah. Yeah, absolutely.
Yeah.
Dara, did you learn anything new from what Priscilla has just said?
Yes, I've learned a lot from her.
Yeah, hold
She
on.
mentioned that when your breast cancer, I mean,
Actually,
sorry, self-examination goes way
actually,
beyond pressing your breast, looking for lumps. That when you look at your breast in the mirror, when you see that your breast skin is looking like the
No, not
back
just the
peel
lumps.
of orange, that you're supposed to voice out. When fluid begins to come out from your breast and you're not breastfeeding, you're supposed
Yeah.
to voice out
yeah.
and go to the hospital. So I really learned a lot from our session. Thank you.
Yeah, hold on. Actually, actually,
I can't remember the exact time, but I know that I was very young when I heard about breast cancer, and I even thought, or I assumed that it happens
No, not
to, or
just the
it could
lumps.
happen to, sorry, that breast cancer happens to only older women. I didn't know that breast cancer is
Yeah.
no respecter
yeah.
of anybody's age. I didn't know that. I thought it was, oh, when you're already old. when you're 40, when you're
Yeah, what
50,
was the
then oh, it could happen to you. And at a point too, I thought it was hereditary. I know it's hereditary
actually
too, but you could even contact it even without having family history of breast cancer. This could happen to anyone. So
regular checkups too are important. There are need to regular checkups.
Yeah.
yeah, so I still checked myself yesterday. I checked myself yesterday just to be sure that we're safe. Press everywhere. Okay, hope no lumps. Am I
Yeah.
good to go? Yeah.
Yeah, I think I don't do regular checkups as much because of money for private hospitals and for public hospitals because of time. I just feel like the queues are so long and I don't want to sit there, but like I really need to pay attention to myself because you know I'm using this engine. Come on, look. I have to be very, very, very careful. I want to throw the same question at Christiana, but I feel like the deeper regular checkups. Like, I mean, you work at the hospital, but the
Yeah, presently I don't work at the hospital.
oh, okay.
I work with an ambulance service
You
presently,
mentioned.
but I still do checkups because trust me, I think I'm always bothered. As little as if there's a pain in my leg that is not going, I'm already like complaining. So the last one I had was with my GP, was just because I felt like my tummy does not feel right. I felt like maybe I was having ulcer. I
Mhm.
kept complaining that I don't feel okay. I don't feel all right. And they did in fact, the GP was so maybe bothered, maybe just wanted to reassure me. All the tests I didn't have to do, she ordered for everything. And I had like five tubes of blood taken from my body, but I didn't mind, just do it. But at the end of the day, everything came out fine. So I think that was like the would I say the wider test now? That was like the most,
Makes sense.
and I had that about 2 months ago because I felt I had ulcer. Because and yeah, just because I'm always scared. If anything happens to me, I'm thinking about 100 things. So that was, and I think it's just very good to be very honest because like she said that day, she told me she's going to like order for all the tests, even my kidneys, even everything. She ordered like all the tests, and she said why she's doing this is the bad situations of now. The sad thing about, I was saying this to my husband recently, that now there's a pandemic of kidney problem in Nigeria,
Mhm.
and it's so sad because when we were in school, I will never forget one thing that one of our lecturers said. The man that taught us renal system, he said our kidneys, until they're 70% gone, there will be no symptoms. So you might, someone might have a kidney problem, but they will not know until that kidney is 70% gone. Which is why in Nigeria, yeah, which is why in Nigeria it is very difficult because by the time people are realizing that there's a problem with the kidney, it is 70% gone.
Wow.
Now, the problem is at that point, it's almost not solvable. So,
Mhm.
which is why for me now, I think it's something I want to look at now. I want to like be very careful with it because you never can tell. God forbid bad thing, yeah.
God forbid.
But yeah, but then so it's just that very important, very everything is, even the early checkup, everything is just still on early detection.
Uh,
As little as if you have like an electrolyte. The last one I had was shortly, I think it was shortly after my period. So they noticed that you have like very low iron or anything. They gave me supplements, but then I wouldn't have even known. But then I was expecting to have low iron because I just finished my period. I just finished wasting blood, but then it just um make us catch on many things. Our body is very funny, and
very.
like I used to, yeah, very very funny. And like I used to say, our body is like pitiful. Like let me not really show you that something is wrong with me. Let me just leave her. So when you like do check up and all of that, it makes everything sense. So please, I know it's difficult really because even when I had to do my own, I had to wait, even though it was not Nigeria. So I cannot now imagine what it is like because definitely we did postings in general hospitals and all of that. I will know it. But then it's just worth it sometimes, really. It's worth it. Let's get self checked around. If you have as little as, I will still message you, Bookie. You have to get the back checked. I will still stress it.
Yes,
You
yes,
must
I
get it.
will. So
You
like,
must get it. Yeah.
yes,
So
I
that's just,
will.
it's very good. It's very important to do checkups all the time.
I
Yeah,
think
it's very
guys are
important.
very pro Christiana. It's very important to do checkups, like regular checkups. You guys check yourself.
Yeah.
You need to know what's going on with your body, in your body, everything. And after you fast, I actually have questions here, but I mean, we've had a very, very, very full conversation. And I would not like to like waste your time. So, like, there's this really dilemma that I want us to quickly discuss before we call it an episode. And the dilemma goes thirst. I am breaking out of the Nigerian sexual system. That's like the topic. And the person saying, I'm just tired, honestly. Tired of how we do sex and sexuality in this country. Everything is fake. People pretending to be holy, religious, straight, normal. Meanwhile, everybody they do things low key. People are exploring crazy things behind closed doors, but in public they are forming righteous. Why are we like this? So this person is just ranting. Why do we have
Yeah.
to hide who we are just to fit into our society? Nigeria is full of sexual frustration and confusion. Almost everything here is about transactional sex, sugar daddy, hookup, coded drop. Nobody is talking about real desires, real expression. And when you try to, people act like you're bad, but deep down, they wish they could be free too. Me, I don't want to pretend again. I want to explore my sexuality. So the questions I want to ask you are written. Do you think Nigerians pretend when it comes to conversations about sex? And do you think Nigerian society, being a conservative society, does us more harm or more good than bad? So that's just it. So the first one is, do you think Nigerians pretend when it comes to conversations about sex?
Yeah, they do pretend though. A lot of people are
Okay.
pretend. I feel they don't want to be judged. They don't want to be looked down
100.
upon. They don't want to be seen as a disgraceful person or as
Yeah.
a slut. So yeah, they pretend a lot, and a lot of
Ọmọ
people shy
burúkú.
from their parents, fear of being judged.
Yeah.
So yeah, that's actually just Nigerians pretend we was like all of us we are holy. Like we don't want to kiss in front of our parents. We don't want to do anything. Yes, we are all like saints. And Christian answer the can you please answer the second question for us? And which is, do you think the Nigerian society being conservative does us more good than harm when it comes to sexual health? Because we are very like conservative society. Nobody wants to talk about anything, and we are very religious as well. Do you think this is very good, or yeah, I don't know? Does it do us more harm than good?
I think if I'm going to tell you the truth, like if I'm going to just say my mind, you are lying to yourself. You are. It makes people lie to themselves. It makes people not be themselves. Yeah, maybe in some ways it keeps the moral, maybe the moral standard. But then people do things. People do a lot behind closed doors, and we just come and go, holy, holy. Everyone, and it's just sad. Yeah. It's just sad because at the end of the day, it is the reason why we have so many problems.
Yeah.
People have STIs, they don't want to talk about it because but sister, whatever, how do you have STI? How do you come about that? So it makes
Yeah.
people like keep lot of things that they should not hide under their skin, or things that they should talk about. They don't want to talk about it because people will judge them, because they feel like people will be disappointed, because they feel like, so it does more harm than good. At the end of the day, that's just the sum. It does more harm than good, because even when people have like sexual problems, when people have like, there are problems that are not even related, you'll be surprised. There are problems that are not related to sex, but because some people are having sex, they don't want to come and say that there's one discharge coming out of their body. It's not even
Actually,
related to the sex. So but they just will feel like, if I talk about this discharge now, they'll be like, they know that I'm already having sex. Let me, and maybe most likely it doesn't even have it might not even be an STI. It might just be your body doing something. It might even be something that has to do with cancer, that does not even have to do anything with sex. But because you are scared of that sex part, you hide it till it's boomerang and you have to now start doing. So no, I would say that it does more than good.
well, that's actually true.
Yeah.
So, like, that brings us to the end of today's conversation. It has been very
I don't want it
nice.
to end. I don't want it to end.
It has been educative, it has been fun, it has been nice, and it has been really good chatting with you people. Thank you so much, Christiana, for finding time out of your busy schedule to like do this. Like, I'm very excited. I'm very grateful. And Matilda, you
Thank
had no
you.
choice. You had no choice. But thank you for coming here as well. Any last words? So, look at.
I do. Thank you so much for giving me this opportunity to feature in your podcast session. And I also want to tell our listeners out there, please
Aw.
like, share, repost, comment, engage, follow, and yeah, I'm sure you won't regret it.
You guys have heard. I'm sure that Christiana's last words will be go and check yourself. But let's hear it. Christian.
Go and check it. Check it. Okay, so this is my last word. Like, follow, subscribed and get yourself checked.
Yes, get yourself checked. And that will be all for today. Thank you so much, guys. Thank you so much.
Thank you. It's been so interesting. Thank you. Nice to meet you, Matilda.
And enjoy the rest of your Sunday, guys. Tomorrow is
Thank you. Thank you for having us, Buki.
Yeah,
Thank you. God bless.